1.1 billion US dollars. That's how much farmers lose from tick-borne diseases and outbreaks in Uganda every year. And most of them are smallholder farmers. My name is Gabriel, and last summer I spent 3 months living in Mbarara, a city in southwestern Uganda. There, I completed a fellowship with Engineers Without Borders Canada, where I teamed up with local Ugandan engineering students to tackle this question. How might we better prevent and treat livestock diseases for rural smallholder farmers? And at first, we approached it like typical engineers, analyzing data, reading reports, and trying to invent some new diagnostic or treatment device. But then I realized, before we can even think about how to solve this problem, we must first understand why it even occurs. So let's take a step back and understand this challenge. By the numbers, livestock health is important. Over 70% of Ugandan households, or 31 million people, raise livestock for livelihood. And of those, 90% are smallholder farmers, producing mostly at subsistence levels, meaning they raise a small number of cattle, sheep, and goat, and raise crops like matoke or bananas just to feed their families and survive. We were located in Mbarara, a city in Uganda's cattle corridor, home to over 14.6 million cattle. Yet, according to the FAO, only 56% of farmers access vet services, despite the resurgence of diseases like East Coast fever and foot and mouth disease, which is costing farmers millions. And there are reports from the FAO, the World Bank, and the UNDP who all echo this, with pages of statistics on disease outbreaks, vet coverage, and funding gaps. But few ask the key question: what does this actually feel like for a smallholder farmer? So to find out, we asked them. We met over 20 farmers in the Nyakayojo grape farming community near Mbarara. Over 2 months, we lived, ate, and worked alongside them in their homes and on their farms. With us, they shared stories of not knowing how to prepare for the dry season, of guessing when and how to treat a sick cow, and what happens when help doesn't come. When I came back to Canada, I continued to dig deeper, interviewing more farmers, more vets, and more frontline animal health workers, all over WhatsApp video call, to understand not just the symptoms, but the systems that make things this way. Now, there are two key systems at play here. The first is a clinical care system, which provides both preventive information, like optimal breeding and proper nutrition, and access to treatment when animals do fall sick. Here, farmers face 3 key decisions. The first is to access the public vet system through either a paravet, who may have varying levels of training and competency, or their local public vet, who is typically difficult to reach. Their second option is to seek private care, which can be quite expensive for rural farmers. And the third, most common, is resorting to informal care, guessing and checking, asking a friend, or using drugs from an unregulated source. This often leads to misdiagnoses and mistreatments. A nuanced category, however, within informal care is the use of traditional medicine. Rather than being inherently harmful, traditional practices exist in a gray area, valuable and trusted, and sometimes effective, but marginalized and unregulated within the formal system, making it difficult to empirically determine which practices are helpful versus unhelpful. The second system is the outbreak control system. This system is meant to prevent outbreak-prone diseases like foot and mouth disease from spreading. But the system is slow. Farmers don't report early signs from fear and mistrust, and even when they do, the response is often slowed down by bureaucracy and funding gaps, resulting in delayed or no vaccinations at all and ineffective knowledge mobilization systems. Together, these two systems fail to equip farmers with the knowledge, resources, and services they need to keep their animals healthy. And from here, I culminated all my research into this system map. And I know it's complicated, so at a high level, we can zoom out and see 4 main groups of root causes. First, livestock disease outbreaks stem from a farmer's pursuit of informal care due to how inaccessible the livestock health support system is, which was set up by weak governance and policy, all perpetuated by a lack of stakeholder engagement. This creates a cycle of mistrust and inefficiency that leaves farmers without the support they need. Now, let's zoom in. First, farmers often feel that informal care, guessing and checking, or asking their friend is their only viable option because of how inaccessible the vet system is. This leads to mistreatments and livestock deaths, which pushes them further into poverty and making it even more difficult to access formal care and deepening their mistrust of the system. Second, the livestock health support system is underfunded, fragmented, and misaligned with on-the-ground realities. First, vaccine and disease surveillance programs are severely underfunded that they can't adequately deal with the resurgence of diseases and rely heavily on foreign aid. Second, vet services are fragmented. Paravets, who are the most accessible to farmers, were only regulated in the summer of 2024 and were heavily reliant on NGOs for their training. Government vets are overworked and under-resourced, making it difficult for them to take on a high caseload. In fact, none of the farmers I have spoken to have ever interacted with or even seen their local public vet. And private vets can charge high fees, leaving only richer farms with rural access. And lastly, despite the majority of farmers relying on traditional medicine, indigenous animal health practices are rarely integrated within formal programming. It is further excluded in research, which makes it difficult to determine which practices are beneficial versus harmful. Now, this whole system was set up by weak governance. A combination of over-privatization, aid dependency, bureaucracy, and corruption has all increased government spending without increasing public service efficiency. The regulatory framework that set up the vet system does not adequately deal with the resurgence of disease outbreaks or recognize the role of non-vet actors like informal care providers and traditional healers, despite their huge role in animal care. And decision-making is top-down, where programs are designed with little input from frontline workers and farming communities. Lastly, farmers feel betrayed by the system, so they disengage. This mistrust, combined with poorly designed programs, manifests as a low uptake of development initiatives, which perpetuates this belief that the problem lies with the farmer, not the intervention. There's a prevailing belief that farmers are irrational for choosing informal care, when in reality, their choices are perfectly logical based on the options and the supports they have. Their mistrust is not a flaw. It's a response to years of being underserved by the very system that's meant to support them. And this disengagement is further reinforced by the absence of national-level advocacy organizations for farmers and frontline health workers. Without formal platforms to advocate to voice their concerns, their voices are excluded from the decisions that shape their livelihood, creating the same cycles of mistrust and misalignment every year. Now, based on my analysis, I've also identified some key levers for change. First, on the farmer level, farmers need to be met where they're at through shared partnership models. This means development programs are tailored to each community's unique context and rooted in the realities and needs. Instead of trying to apply a one-size-fits-all solution, solutions should be co-created with farmers to empower them and build trust. On the livestock health support system level, there should be real, legitimate training pathways for paravets and informal care providers like traditional and spiritual healers. Allowing them to combine their traditional local knowledge with scientific training creates a more integrated system of care. Further, more funding is needed for rural public vets to better equip them and incentivize them to serve smallholder farms. On the governance level, an intentional and respectful effort to include indigenous animal health knowledge in research, decision-making tables, and program planning to increase program uptake and also determine where indigenous knowledge is more effective than Western medicine. Further, the use of randomized control trials, or RCTs, will ensure that policies are evidence-based and institutionalized, protecting them from political change and corruption. Lastly, the use of a vet accessibility index can help guide resource allocation to prioritize underserved rural areas. And on the socio-political level, we must address the lack of stakeholder engagement by creating minimum consultation requirements for farmers and frontline health workers in program design to ensure that they can advocate for their needs at the micro scale. Further, the funding and establishment of farming cooperatives and advocacy organizations so that they can advocate for their needs at the macro scale. Now, I didn't do this project to prescribe solutions or to proclaim myself a savior. I just wanted to understand why the system felt so stuck. This process has taught me that systems are not broken because of individual failures. Rather, they're broken because of misaligned policies and unacknowledged power dynamics. My training in engineering and economics has taught me to solve problems through data, research, and innovation. But understanding the farmers' lived experiences as I sat with them in their living room or I walked the roads to bring produce to the market with them has taught me more about the complexities of this problem space than any report ever could. I've also learned that the people closest to the problem often hold the best insights. They're not just victims, they're experts in their own right. We need to stop assuming what's best for them and start asking and listening. So if there's one thing I hope you take away from my presentation, it's this. People living in poverty are rational. Their choices reflect the systems they navigate. And if we want to change those systems, we must meet them with respect, not assumptions. Thank you.